Hi, my name is Dr. Michael Veslak, and today we're going to go over an exam we do to determine if a patient is in the fight or flight or maybe the more parasympathetic dominant pattern. Rather than just guess, we like to do different tests to try to figure out what's really going on with that patient. So first, when you're talking about the parasympathetic nervous system, which most of us know as the vagus nerve, we're looking at things like decreased saliva production, decreased tearing, sometimes not a gag reflex. So we just go through a couple of these tests and we just kind of evaluate it. Where on the other side, with a patient that's a more sympathetic response, more of a fight or flight, some of these patients have what we call dysautonomia, where the autonomic nervous system is ramped up. We're looking at things like increased heart rate, dilated pupils, sometimes excessive sweating. So this is basically what we do. First, during the exam, I put a pulse ox on so I can measure the heart rate to see if it goes up any times. Like certain conditions like dysautonomia or POTS, it can go up during the exam. You can just relax that. Yep. And then what we're going to do is, with the lights bright, I just kind of look at the eyes just to make sure we have enough, enough tearing, so hers are nice and moist. And then we just kind of have her open her mouth and say, ah. We look inside just to see if there's enough production of saliva. And then we'll ask a question like, does it take you a long time to chew your food, which means they're not really producing enough saliva. So we just kind of look at them. And then I usually have them just, I'll get the tongue depressor. And we just have them say, ah. Ah. I have them do it about 10 times as I'm looking, because what we're looking for is to make sure, say ah, again, again, again. Okay, so we do that about 7 or 10 times, because if the brain is fatiguing, pretty soon we don't see that palate elevate. And when a soft palate doesn't elevate, that means we have a vagus nerve problem. And if, so we're looking at the soft palate in that situation. And then when we have the tongue depressor down, we kind of go a little bit deeper and create that gag reflex. When we hit that spot, we're supposed to gag. That's normal. But if it's, if there's no reflex, we know we have a problem. So that's basically the parasympathetic exam. With the sympathetics, more the fight or flight, like I talked to you, we're looking at heart rate. So hers is right now 65, which is perfect. And it really hasn't gone up too much during the exam. And then we look at like dilated pupils. So we're just going to shine the light again and just look to see if the light creates it. Yep, that's good. Okay. And then we look for things like circulation. So what we want to look at with circulation is, one, does the hand, does the coloring look good? Is there fungus on the nails, which is none. But if you're getting lack of circulation, which happens a lot in the toes, because it's farther away from the heart, we tend to start to get fungus in the toenails, and that usually means bad circulation there. And then I'll just take this and I just kind of run it down the extremities, just kind of measure what the circulation is. There should not be a 10-degree difference between the fingers and the hands, and she is good. And then I'll do both sides, and I do the legs, and she is good. And then I talked about excess sweating. As I'm examining the patient, some people get a little nervous, but we just have them lift up their arms. We make sure there's not a lot of sweat underneath there and not perspiring excessively. And basically that is your exam to determine if a patient is in more of a parasympathetic vagal tone, which corresponds to more rest issues, so sleep and digest, or more fight or flight. Okay, thank you.